Treatment options for azoospermia. So azoospermia, just to recap, is the lack of sperm in the ejaculate. These can, broadly speaking, be broken down into two aspects. One is trying to get sperm through a procedure from the epididymis, which is a structure that wraps around the testicle, and the other is trying to get sperm directly from the testicle itself. The first normally involves needle aspiration from the epididymis. That's called a PESA. It stands for Percutaneous Epididymal Sperm Aspiration. And that involves putting a needle, normally under local anesthetic, with or without sedation, a very fine needle into the epididymis to try and extract sperm. That is reserved for patients where we think that the underlying mechanism of sperm production is intact, and we're fairly sure that by passing a needle in, we're likely to get sperm. Another option, if we can't access the epididymis or we feel that it's not appropriate in that case, is to do something called an open TZ. That involves making a single incision, normally very, very small. This can also be done under local anesthetic or general anesthetic in the testicle itself. And again, the premise for this procedure is that we believe that the underlying testicle and the sperm production with it is intact. So if we take tissue from anywhere in the testicle, we can be fairly sure we're likely to get sperm. Last but by no means least, and quite often referred to as the gold standard procedure, micro-TZ. So that also involves accessing the testicle itself, but this is very different. It's done under a general anesthetic. Both testicles are accessed and they're both opened under the guidance of a high power microscope. That allows us to look at the testicle in great detail on both sides and try and access what we think are the best looking tubules to increase the chance of retrieving sperm successfully. We generally reserve that procedure for men where we think there is likely to be an underlying problem with the production of sperm, and therefore we can't be sure that simply going anywhere in the testicle at random is likely to give us the result that we want.